Good evening, ladies and gentlemen, and welcome to Battling and Beating Cancer here on CAN TV 21. I'm Scott Seaman. I am a 23-year trial lawyer. I try cases and I go up against adversaries in the court of law every day for a living. But about 12 years ago, I confronted an adversary that I did not think I could beat, and that adversary was cancer, actually non-Hodgkin lymphoma. And fortunately, I was able to beat the disease because I was lucky, because I had good doctors, and because I had a fabulous wife, Charlene, who will be phoning in shortly or coming in and joining us for this show. Now, we have really taken our show as an opportunity to introduce all of you to some of the best doctors in the business that deal with blood cancers, so that you get important information from reliable sources, but also so that you get to know some of the best doctors in the business. But tonight, we change our tune a little bit. We've taken off the suits and put on t-shirts, and we've locked the doctors out of the studios, and we're going to just talk cancer survivor and cancer caregiver one-on-one to you about the good, the bad, and the ugly about cancer. And so we're going to get started in just a couple minutes with that show, and we're going to tell you some things that the doctors, I think, will agree with, and maybe some things that doctors don't want to hear. So we're going to get going with that. But first, I do want to tell you that if you need to reach us at the Chicago Blood Cancer Foundation, we would love to hear from you. www.chicagobloodcancer.org, 888-792-9992. And Charlene, are you there? Hello, Charlene. Well, you're en route, in traffic. We want you to drive safely. But we want to start telling the folks about what a fabulous time we had this Sunday with our Out for Blood bike ride. And we had all sorts of determined riders, generous people donating, volunteers, our wonderful sponsors and media partners, all coming out to take action to beat blood cancer. And some of our folks decided to bike ride 10 miles, some 20, some 50, some as far as 100. They went all the way to Kenosha and back, and it was a fabulous, beautiful, sunny afternoon. We raised important money and important public awareness for blood cancer research, didn't we, Charlene?
Yes, we did. We had a really good time. It was a nice day, and it was really our first bike ride, and it turned out really well. And we're going to do another one next year. Absolutely,
and of course, our Out for Blood team, we're not just myopic. We will do bike rides. We will do walks and runs. We will do vampires nights out, all sorts of fun events to raise money and awareness for blood cancer research. So if you want to get involved with us, or if you have an idea for an event, please, again, give us a call, 888-792-9992. We would love to hear from you. And let's, honey, do something that is a little bit off of our normal format and talk to people about sort of the ins and outs of surviving your hospital stay, beating cancer from our perspective as a cancer survivor and as a caregiver. How does that sound?
Sounds great to me. I should be at the studio pretty soon, but in the meantime, I'll just stay on the phone with you. All
right. See, this is the beauty of live TV, folks. And one of the things that a lot of us have to do is go to the hospital, and it's scary, and it's one of those things where sometimes you don't have a choice. It's an emergency situations, but a lot of times as a cancer patient, you know ahead of time. And sometimes your choice of hospital is determined by your choice of doctor. You go to the hospital that your doctor has staff privileges at. But sometimes you're involved in the selection process. And like everything else, like when we were talking a few shows ago about selecting doctors, the same is true for hospitals. They're not all the same. Do your research. You can find out what the death rates at a particular hospital are, what sort of issues and problems they may have with hospital-borne infections and those sorts of things. There are websites, there are sources for that information. Charlene and I, our preference is, especially when you're dealing with something like cancer, go to either a comprehensive cancer center, as designated by the National Cancer Institute, or a teaching hospital. You get the best care and the best doctors more times than not from those sorts of institutions. And also, we don't want to discriminate against small hospitals, but many studies show that the death rates in hospitals with less than 100 beds can be as high as 40% higher than at the bigger hospitals. So you want hospitals that are experienced in the type of disease you have and the type of treatment that you're going to undergo. And honey, one of the things you need to do is get in and get out as fast as you can.
Right. And again, I was going to add to that. When you're diagnosed with a cancer or a devastating disease, you want to get the best care that you can. So, and like Scott was saying, you have to kind of do some research, find out where the doctor is in your town or your city in Chicago. As far as who's the specialist, who specializes in your disease, and there's a lot of things and precautions you can take when you go into the hospital. And again, you want to do some research on that.
And, it's also important, if you have a choice, like everything else, statistically, you're better off not going in on a holiday or a weekend because, like many other places, hospitals, a lot of folks are based on seniority. And if you play the percentages, the better staff, the full crews are there during the week. So if you have a choice, pick a weekday. And also, I think a couple things are sometimes viewed as unhealthy, but when you're in the hospital, it pays to be a germaphobe and to believe that cleanliness is next to godliness. Isn't that right?
Yes, and again, we'll talk about, let's talk about my mother briefly, how, she went into the hospital with a small case of pneumonia, and 5.5 months, she never came out again. And this happens quite a bit because there are a lot of hospital germs. MRSA would be in the number one that is very deadly, and a lot of people don't notice until they get in the hospital. And you have to take precautions. And if you see that the nurse or doctor isn't wearing gloves, then you must tell them. But try to be, again, we don't know what's in the hospital, but I can tell you one infectious disease doctor told me one time. That going into the hospital is like going into a war zone. So you want to get in and out, and the more things they attach to you, IVs, everything that goes in your body, has the chances of, causing infection. So it's really important. My mother wound up on a ventilator, wound up on dialysis. It took 5.5 months to transfer to 3 hospitals. But once you get into the infection mode, very hard to get out. So you have a compromised immune system, be very careful. And I did tell the doctors, could you wash your hands? And it was my mother, and I didn't really care. So you have to take your own, you have to do your own research, your own precautions, because sometimes, healthcare workers aren't doing the job. But the CDC right now has a little more control on this, and they're putting programs out there to take precautions and stuff. So the hospitals are doing better, but they still are not.
And you're really right. I mean, obviously, one of the things I say that Charlene is a checker. You sort of, as a patient, or have your advocate checking everything, double checking on the medications, double checking on the procedure that you're going to have, double checking. I mean, lots of people have gone in and had the wrong limb removed. Lots of people have died because they were given the wrong medication or the wrong dosage. So even though you're the patient and you're not supposed to be the one doing this, the healthcare workers are, you're going to bear the consequences of it. So it's important to know what the treatment plan is. Ask questions if something doesn't seem right to you, or you're not sure whether you're getting the right treatment or the right medicine. Ask the questions. Insist that somebody else take a look at it. When you get your test results, look at them yourself, or have your caretaker look at them. Number one, it's going to give you information the doctor may not tell you. You may not understand it, but it gives you an opportunity to have that dialogue, to ask those questions. And it gives you an opportunity to also send the message to your healthcare providers that you're watching, you're keeping your eye on the ball. And that tends to make them watch things and double check on their own a little bit more. And even though you may be under the care of a doctor who's sort of the captain of the ship, a hospital is a place with all sorts of people. People who are trained, people who are untrained, people who care, people who don't care, people well compensated, people who are overworked. And you're not only dependent upon the doctors and the nurses, and nurses overall are just wonderful because they actually give a lot of the care, but it's the orderlies, it's the person that's taking the blood. And so the least common denominator, if that person isn't careful, you could get an infection or you could be put through unnecessary procedures. So you have to watch it all. It's not to be critical, but it's just the nature of a hospital. While people think hospitals are a place of healing, they're also a place where you have to be very careful to make sure that you're given the right care. And you have to also shepherd things through because you could be lying in that bed for days waiting for tests. And so you have to sometimes keep on top of things to make sure you're getting the tests and the procedures that you're supposed to get when you're supposed to get them. And have an advocate with you at all times. When you're in the hospital and you're undergoing treatment, you're not yourself. You're not feeling up to par. You may be sleeping from time to time. Have somebody there who's your eyes and ears looking out for you, asking those questions. And, bring the things that you need. Bring comfortable clothing. Doctors sometimes in the hospitals, they like to have you in those robes where you're given free shows. And bring your sweats. Bring stuff that you feel comfortable in. Bring some of the personal grooming items that you need because a lot of times they just don't have them in hospitals. And, honey, you would disagree with this, but I would say don't eat the hospital food.
Yeah, I would definitely agree with that. Don't eat that hospital food. Don't.
And the other thing is, you get through and you can't wait to get the heck out of there a lot of times. But you really have to learn and understand your discharge instructions and what you're supposed to do so that when you go home or you go to a care facility, whatever the case may be, and your caregiver knows what medications you're supposed to take, what you're supposed to do, and what you're supposed to look out for. So surviving your hospital stay, also bring information and lists with you. If you're there in the hospital for 3 days or 4 days, you will be asked somewhere between 10 and 1,000 times what medicines you're on, what your health history is. If you have a list of all that stuff, you can not only refer to it, but they could put it in the file right there so that they've got all the correct information. Let's talk a little bit now about some of the tips that doctors may not always tell you. And one of the things a lot of times they don't deal with is fertility. When you go through a lot of cancer treatments like chemo, it can affect your fertility. So if you want to have a baby, consider and talk to your doctor about freezing sperm and eggs and what steps you need to take to do that. Stem cell harvesting. Sometimes for some procedures it makes sense to harvest some of your stem cells before you undergo treatment. Talk that over with your doctor. Sometimes you can donate blood to yourself ahead of time. So if you have surgery or if you lose blood, you could get your own blood back. And we're going to be talking in the next show with LifeSource all about donating blood and how important that is. And honey, one of the things I say is a positive mental attitude is great, and God love the people that can have it. But I didn't have a positive mental attitude, did I? I had something that I think is even more important, though, which is the will to live. If you have to be mad, if you have to be angry, if you're scared, if you're nervous, even if you're a little bit negative, all of that is okay as long as you have a strong will to live.